acne is not skin deep. Acne has to do something with your internal health.
Having dirty skin is the major reason for acne.
No, I think having dirty skin is the biggest misconception.
Whenever we talk about acne, people talk about chocolates. They say chocolates are really bad for acne.
I have to say that chocolate is a very poor villain there. The reason is the dairy in the chocolate, the milk in the chocolate, the sugar in the chocolate.
What do you think, are pimple patches really something that can work on acne?
More of a social trend, a little bit of science.
Factors where they apply, like let's say toothpaste or baking soda or something, about the home remedies.
Before you think of applying baking soda to your skin, before you think about applying toothpaste to the acne, respect your skin.
Namaste and welcome to Apollo Health Podcast, health conversations that matter. Today's topic is something almost everyone has dealt with at some point of time, acne. For some it starts during teenage years and for others it appears suddenly in adulthood. And for many people, it is not just about pimples. It affects confidence, mood, social comfort and even mental well-being. But acne is also surrounded by a lot of myths. Is acne caused by oily skin? Does chocolates really trigger pimples? And can blood tests help identify underlying causes? And are social media skincare trends making acne worse? To discuss this, we have with us dermatologist Dr. Saguna Puttu from Apollo Clinics, India's leading chain of neighborhood clinics. Hello doctors, it's an absolute pleasure to have you over here.
Thank you for having us here.
Dr. Saguna, so we want to discuss about the primary reason for acne, right? A lot of people say that having dirty skin is the major reason for acne. Is that true?
No, I think having dirty skin is the biggest misconception that a person can have. In my practice, I've seen people who use many cleansers, keep on washing their skin because they feel it is dirty, actually end up worsening their acne. So harsh products, they lead to irritation of the skin, inflammation, and subsequently a lot of acne.
Okay, so are we saying that overwashing is also a huge problem?
Yes. Actually, you have to be as gentle with your skin as is possible. Use non-comedogenic products. Don't go very harsh. Use a gentle moisturizer and stay away from washing frequently. The biggest myth is the oil is coming up on the skin, they need to wash it. So people end up washing multiple times in a day. That's a problem.
Also, when we talk about the deeper problems, apart from acne being the external factor, can it be something that is triggering from inside as well?
Yes. I think the most common line that I use when I'm counseling my patients on acne is, please understand, acne is not skin deep. Acne has to do something with your internal health. And most of the times it is a hormonal imbalance. And that is why we'll see acne primarily coming in adolescents, young adults. However, these days it's not uncommon to find acne in adults also. Again, the same reason, hormonal imbalances. So a hormonal imbalance could be a sign of internal PMOS, earlier called PCOS, insulin resistance, family history of diabetes, your sedentary lifestyle, junk food, and these days occupational changes also. Some people work through the night, they don't have a fixed time to eat. So there are multiple reasons which are within your body and giving rise to acne.
Okay. And doctor, when will someone know that the problem, the acne problem is so deep and they should get it treated? Because a lot of home remedies that people follow as well. How would you address it?
So following home remedies is something that is a natural instinct to people. You know, love to listen to your aunt, to your friends, to the influencers on the social media. But an acne which has been persistent, which is recurring, a lady sees a premenstrual flare-up of acne, no acne on the face, but persistent acne on the back. Suddenly the acne came and it became pustular, it is painful, it's more located on the lower half of the face along the jawline. These are indicators enough that you should go to the doctor, to a dermatologist, a qualified dermatologist, and get the remedy. Get the understanding what is the reason for such a kind of acne which is persistent or is leaving behind marks and scars.
Dr. Saguna, when we talk about acne, there are a lot of myths around acne in the social media and even in the general discussions. So I really want to ask about it. And whenever we talk about acne, people talk about chocolates. They say chocolates are really bad for acne. And what do you have to say about it?
I have to say that chocolate is a very poor villain there. Unfortunately, the first person to be caught for is a chocolate. But chocolates basically are not the reason. The reason is the dairy in the chocolate, the milk in the chocolate, the sugar in the chocolate. If you take dark chocolate, it is not that harmful. However, having said that, it is not only about chocolate in your diet. It is about the amount of processed foods in your diet, the sugar consumption, your lifestyle, and those foods which give an instant spike, like a soft drink laden with sugar. So all these foods, if they are in your diet, then chocolate is a very small part of it. Not necessarily we need to blame chocolate always, but the overall lifestyle and the diet, yes, that has to be looked into.
Yeah, since you spoke about dairy, how exactly the milk or milk products affect someone's acne? Is it real that the milk affect the acne problems?
Yes, it is. So dairy in our body is actually giving rise to something called as insulin spike. And this insulin spike raises insulin-like growth factors in our body, and they are triggers for acne. More or less, I would say, if you do not have a family history of diabetes, you're not on the heavier side, you have a healthy lifestyle, you're balancing your nutrition through the day, then a probable consumption of dairy in normal limits should not be a trigger. But if all the other factors are not in your favor and the consumption of dairy is on the higher side, then certainly it's going to be an accelerator for your acne.
And I also feel there are a lot of wellness myths as well. Like, for example, one of my friends who was dealing with acne problems was telling that she would go on gut cleansing thing for next 1 week, and then her entire gut would be cleansed, out of which her acne would be cleared naturally. Is that true? Can that really happen? Or is it just a myth?
So gut-skin axis does exist, but a detox diet and gut cleansing through um, unsolicited advice, not having a scientific background to it, is certainly going to be harmful. But respecting your gut by the consumption of right amount of prebiotics, postbiotics, again a fiber-rich diet, low glycemic index, yes, indirectly it means that, but not the way people understand it. So there's nothing like something doing a gut cleansing, detox waters, going on liquid diet for days together, and then imagining a miracle to happen on the skin. It doesn't work that way.
Okay. And how about pimple patches, ma'am? What do you think? Are pimple patches really something that can work on acne, or you think it's just, again, social trend?
More of a social trend, a little bit of science, more of irritation, more chances of leaving behind a mark, more chances of irritation, and psychological dependence on something like a patch getting a quick fix for your acne, leading to delay in seeking treatment and having marks and scars forever.
Also, for all the gym goers out there, everyone who's working out would be sweating a lot as well, right? So they say that excessive sweating would also lead to acne. Is that correct?
So excessive sweating and staying wet, staying in humid places, letting the sweat sit on your skin for a longer period of time can be a trigger to acne. But sweating in itself is going to be good for you because you raised your basal metabolic rate, you pumped your hormones, your heart is functioning better, you have a better insulin resistant state in your body. So exercise per se is not the problem. Sitting with the sweat for a long time is a problem.
That means that technically it's not one food that is problematic, right?
So long, long ago, there was one line which was taught to everybody in the school is have a balanced diet. I think that holds true even today. So if we have a balanced diet, we are sure to stay away from negative influences of diet and are able to maintain a healthy skin as well.
So, also talking about the stress, right? This is one factor that's triggering every person on this planet now, especially being in the mega cities. We're all rushing here and there. So, the stress is the common factor for everyone. And Dr. Saguna, I want to ask you, how exactly stress related to acne, and is it real that there is a connection between stress and acne?
Yes, these days everybody is stressed. And stress releases certain hormones in our body which are pro-inflammatory. Cortisol is a very common word these days. Every other person knows about cortisol. So cortisol is a hormone which is produced by our body in response to stress. And cortisol triggers many other biochemical changes in your body which makes you acne prone. That is number one. Number two is stress is certainly going to disrupt your lifestyle. You must have heard people going into binge eating because they are stressed, forgetting to take care of themselves because they are stressed, picking and scratching on their acne while they are thinking about something, leaving behind marks and scars. So stress does give rise to accelerated acne, worsening of acne, and leading to certain changes in your body which make you more prone to other things other than acne. Acne is basically a manifestation of a endocrine metabolic syndrome. So stress will show through acne while you're having many other changes in the body.
And technically, that means that acne is not just an external problem, it is also from internal
Yes,
problems.
again, acne is not skin deep. Acne is a reflection of your body. Acne is a reflection of your health.
Doctor, there's a lot of social media myths and a lot of social media practices that keep going on about the acne. Especially acne is one such problem where there are a lot of fundamentals that are associated and a lot of people have everything to say about it. So when we talk about social media, how it's going out there are some factors where they apply, like let's say toothpaste or baking soda or something about the home remedies. So what exactly you have to say about it, doctor?
I think I would want to give a nutshell statement on that. Before you think of applying baking soda to your skin, before you think about applying toothpaste to the acne, respect your skin. Think whether the toothpaste is meant for teeth or for your skin. I mean, it's just basic common sense. Before you damage your skin, you damage the skin barrier, make certain changes which are irreversible and irreparable. I think it makes sense to visit a qualified dermatologist. These days, we have so many new treatments available, safe and effective, without any downtime, giving you the best skin of your life that you deserve. Certainly, everybody is wanting to have good skin. That is why they go to social influencers, social media, wherever they get an information about acne. But that is disrupting their skin. Better to take a qualified advice, get started on the treatment for acne as early as possible before irreversible damage to the skin happens.
So, Dr. Saguna, when should someone see a doctor exactly? I mean, like if someone has 2 or 3 pimples, is it okay for them to treat it at home? Or like when should they exactly visit a doctor? What would you say about it?
That's a very interesting question. What happens generally when a child or an adolescent has acne, parents come in and say it's going to be a matter of few days and your acne is going to get cleared. I would give a pointer here. Parents should see their skins because their children are certainly going to have some genetics from the parents. If the parent has been a scarer, then it is better to take their children to a qualified dermatologist at the earliest. This is one stage of life wherein acne is going to happen. Second is a girl sees acne every month before a period. Then they see blackheads are just popping up everywhere and there are pores. That's a very common misconception. They call it pores, actually they are scars. You see a lot of acne on the back. And the back acne is just not going away. You find a strand of hair growing on the chin, which was not there earlier. So all of these signs are showing that something is not okay inside. So they need to go and see a doctor. Before acne scars their face forever, better to take an earlier intervention.
And since you spoke about the back acne, what exactly could be the reasons for the back acne as well?
Majority of the times, back acne is the indicator of hormonal changes in your body, majority of the times. So you will see girls having hirsutism. Hirsutism means they have unwanted hair on the face, somewhere on the body also. But for boys, majority of the times, this hormonal acne will come as severe acne on the back. They will have thick scars along the jawline. The rest of the face is clear. Okay, so these are certain situations wherein back acne needs to be taken seriously. Back acne leaving behind marks, back acne showing scars, back acne being a social problem for you not to go for outdoor activities wherein you need to be, in a vest or maybe some topless dress like a swim. So that is affecting the social confidence, their presence. I think these are indicators enough.
So since we spoke a lot about the acne and the social media trends and like what irritates acne and about the dietary responses and all of that, let's talk about the prevention and cure of it. So Dr. Saguna, how exactly someone completely prevent the acne? What would you suggest someone who is in the adolescence or someone who's even around 20s and 30s? How can they completely prevent the acne as such?
So as long as you're not genetically blessed, there is nothing that can prevent acne completely. However, we can make certain changes in the way we look after our skin. So don't go harsh, don't go quick fix remedies. Have a sustained, dedicated skincare routine. See a doctor when it is required. Follow a gentle cleanser, moisturizing, sunscreen routine. use a medicated product as advised by your doctor till the specified time. See a doctor at the earliest if you see that the mark is not fading, your stress is building up, you see a scar. I think if a person does all of these things along with a balanced diet and a good lifestyle, is certainly not more to ask for.
And doctor, when someone has acute acne, like when it's terrible acne with full of redness and all of it, how long can it take to be completely cured?
That's an awesome question, Pratyusha. Every single day, I do come across at least a couple of girls, or a boy or a man going for an interview and they have acne, and they come as a quick fix. Okay, they have finally landed at a dermatologist's door, and now the dermatologist should give a miracle treatment. Acne should disappear. Girls come a month before their wedding with a lot of acne, and think that a treatment is going to be like a miracle and things are going to clear. What happens, we have to understand again the same thing. Acne is getting triggered from something that is internal, and it's going to take time to fix it. So I would say earliest that a person can start experiencing betterment of the skin, improvement in the number of lesions, means the lesser the lesion count, lesser acne, would not be less than 4 to 6 weeks of initiating the right kind of treatment. So better to go to a good qualified dermatologist, get a treatment tailored to your skin type done to accelerate the clearance of acne. So it's very important for a person to understand, longer your acne sits on your face, it has the time to leave behind a mark or a scar. So the quicker and effective remedy is given, the better your results will be.
When talking about the quicker results, so there are a lot of treatments out there in the dermatologist's point of view which can be done to treat the acne a little more quicker. So if you can mention that to our audience, how exactly the acne can be treated and what treatments are the best suited for them.
Sure. So when a patient is visiting a qualified dermatologist, we have taken into account your skin type, your lifestyle, your hormonal changes, any triggers for your acne, any concomitant medications that a person is on that could be a trigger of acne. Having taken all of these things into account, a proper prescription is planned. So you will have a prescription which starts from your cleanser till the night care routine. You will have certain oral medications to look after the changes that actually brought acne. Now coming to the clinic point, like we can do a peel. We can do a chemical peel. The word chemical sometimes scares people, but we have to understand water is also a chemical. So a peel that is done for the skin to get rid of the inflammation, the comedones, the blackheads, which are the worst indicators of severe acne coming ahead. You can get a micro needling done if you already have scars. You can get a Q-switch tendiag laser done if you have marks, uneven tone, or you had the habit of squeezing your acne and you got black spots. So there are multiple options available in terms of the treatments that can be done for quicker clearance of acne, reducing the inflammation, and actually giving you a spotless skin that you wanted.
Sorry, doctor. So since we're talking about the chemical peels, how long can someone get rid of acne, and is it a way to completely clear out your skin and not having the acne to get back again?
Yes, again, that's a very valid question. So acne peel or any chemical peel which is being done for acne is meant to have a quicker transit time of acne. But this is not the only solution. We have to work internally, as we have been discussing for the last few things, is internal things have to settle down. If your internal triggers have been taken care of, you can be assured of a lasting result from the treatments that were given to you.
I think it's great insight for anyone whoever wants to watch about the acne. So it's very common problem for each one of us, and we have known so much about it. Thank you so much for joining us today.
It was a pleasure being here, Pratyusha.